Hello, everyone. My name is John McFarlane, and I'm the President and CEO of the London Health Sciences Foundation. Thank you for joining us for this morning for this amazing announcement. Today, we come together to announce a transformational gift in support of the Archie and Irene Verspeeten Clinical Genome Center. Tempering the joy, we must begin today's announcement recognizing Ron Verspeeten, Irene and Archie's son, who sadly passed away quietly at home with his family by his side at approximately 5 o'clock this morning after a long battle with pancreatic cancer. This is profoundly sad, and our hearts go out to the entire Verspeeten family for this devastating loss. Archie and the family wanted to proceed with this announcement as Ron would have wanted to, but we do so with heavy hearts. Ron was a valued member of the London Health Sciences family, and he'll be missed greatly by all who have had the great pleasure of knowing him and his kind heart. 18 months ago, we had the pleasure of announcing the creation of the center through a generous donation made by Archie and Irene Verspeeten. Today, we're honored to announce that Archie and his late wife are making another generous $3 million donation towards the Verspeeten Clinical Genome Center's $10 million vision. Although we're not in person, we have the privilege of joining virtually to announce their gift and to learn about the impact of the Archie and Irene Verspeeten Clinical Genome Center is having on patient care in our community and beyond. Cancer genomics, translating research to patient care. To guide us through this groundbreaking year and a half and what's in store for the future, we have as our panelist, Dr. Beckham Sadikovic, the scientific and clinical Director and Chair of the Clinical Genomics and Epigenetics Verspeeten Clinical Genome Center, Jennifer Masters, Director of Molecular Diagnostics, Verspeeten Clinical Genome Center, Partnerships and Innovation, Dr. Stephen Welch, Medical Oncologist, Chair, Division of Medical Oncology, Dr. Dan Bredner, Assistant Professor of Medical Oncologist, Molecular Tumor Board Chair. We also have Jackie Schleifer-Taylor, our President and Chief Executive Officer at LHSC, and our moderator, Nick Paparella from CTV. Thank you to everyone who's joining us today. As we make this announcement and reflect on the impact of the Verspeeten Clinical Genome Center has had on patient care, we'd like to take a moment to honor Irene, Archie's late wife, and their late sons, Alan and Ron, each passing away from cancer. It is with their memories at heart that the Archie and Irene Verspeeten Clinical Genome Center was originally created and is made with them in mind today that this remarkable gift is being made. The Verspeeten Clinical Genome Center has already had a profound impact on the lives of patients at LHSC and on patient care throughout Ontario. The reality is the best is yet to come. As research breakthroughs are discovered and new treatment options are explored, the Verspeeten Clinical Genome Center has the ability to completely redefine the standard of care and how patients are treated. Archie and Irene's vision and passion to find a cure to end cancer is the driving force to make anything possible through the center. In its short tenure, the Verspeeten Clinical Genome Center is already having an impact beyond our community at an international level. We are motivated by Archie, Irene, and their family to inspire change for future generations and are extremely grateful for the generosity they've shown LHSF and LHSC over the years. Today, Archie and Irene are providing one of the greatest gifts possible, hope. Their gift of $3 million to the Archie and Irene Verspeeten Clinical Genome Center is giving continued hope to patients at LHSC and allowing for the growth of valuable resources in our community, making tomorrow better. I'd like to share a few words from Archie at this time. As I was almost 2 years ago, I continue to be humbled today that we are able to support a life-changing program like the Verspeeten Clinical Genome Center. My wife, Irene, and I know firsthand the costs that can come with cancer diagnosis. I wish for no family to endure such pain and no patient to experience such suffering. I want nothing more than to end cancer completely. I believe this center has already brought us one step closer to better understanding some cancers, but there's still further work to be done. My hope is that our gift can provide time to patients and families when it may be running out, and that the Verspeeten Clinical Genome Center can continue helping patients with genetic diseases live longer, fuller, and happier lives. Thank you very much, Archie. I know you're watching, and with heavy hearts, we continue with this announcement. And at this time, I'd like to invite our President and CEO, Jackie Schleifer-Taylor, to bring greetings.
Thank you, John. Good morning, everyone. As John mentioned, I'm Jackie Schleifer-Taylor, the President and CEO of London Health Sciences Centre. On behalf of our staff and physicians, and most importantly, our patients and their families, it is my pleasure to attend today's event. I want to express our deepest gratitude to Archie and Irene Verspeeten for not only making the Verspeeten Clinical Genome Center possible within the past 2 years, especially in light of everything else that's been going on. They have been a light in the midst of the storm. I also want to thank you for your continued support and remarkable generosity that we are here to celebrate today. It is because of you that we are able to translate genetic testing to personalized care right here at LHSC. This means that treatments can be tailored to our patients, helping improve outcomes, helping to save lives. We are truly grateful to the entire Verspeeten family for your vision, inspiration, dedication, and drive to create change that continues to help pave the way to a better future for our patients. The Archie and Irene Clinical Genome Center has already created change for patient care locally and provincially. As the major acute care center for London and the entire Southwest region, LHSC is dedicated to achieving and exceeding the highest standards of care by putting patients at the center of everything we do. Donor support, like that of Archie and Irene Verspeeten, is crucial to enhancing the standard of care at LHSC and beyond. As the major acute care center for our region, this standard is critical to continuing improving our capabilities to meet the needs of our patients and the populations we serve. Through the exceptional generosity of donors, LHSC is able to provide the personalized care, and world-class researchers and research our patients need when they need it the most. As we move out of the pandemic into the recovery phase, part of our realignment plan here at LHSC is to strengthen our research and academic arms. Your gift today propels us forward. The opportunity to personalize the treatment of patients cannot be understated. Every person is unique, and their treatments should be just as unique. When I think about what has been accomplished in the past year and a half with your previous donation, I get really excited about what the future holds with today's announcement. I feel this new funding puts the Verspeeten Clinical Genome Center on the brink of something truly remarkable. I'm incredibly proud to be part of the exceptional team here at LHSC and part of a community that continues to help push the frontiers of medicine. Archie, Irene, and the Verspeeten family, it is an honor to be here today to celebrate this transformational gift. On behalf of London Health Sciences Centre, thank you. Thank you for your continued generosity, your desire to find a cure to end cancer, and your drive to change patient care for those suffering with complex genetic diseases. You are making a difference. I would like to now invite Nick Paparella to join us as your moderator for today's event. Thank you.
And Jackie, thank you very much for those kind words. It is a pleasure for me to be here this morning, as always, guys. And I know we're going through it. The last couple of years have been difficult. Normally we do this in person, but eventually, folks watching at home, we are going to be able to get back to doing this in person when we're all together. But for now, it's virtual, but I am very, very thrilled to be here. And we are, folks, so fortunate. I say this all the time. We are so fortunate as a community to live in a city with the medical facilities that we have, and a facility like LHSC with such wonderful caring doctors, researchers, and nurses. And also hats off to Archie and his family for this kind and generous donation. And Archie, our hearts all go out to you and your family this morning. So today, guys, we have several speakers discussing the impact of the Verspeeten Clinical Genome Center has had on the care in the past year and a half. And the influence it has had on igniting policy change in the Ministry of Health, and what the future holds beyond genomics. Now, this will be followed by a short Q&A with our panelists that will spur on insightful conversation for what is in store at the Archie and Irene Clinical Genome Center. I now welcome Dr. Stephen Welsh and Dr. Dan Bredner. Dr. Stephen Welsh is the medical oncologist at the London Regional Cancer Program at LHSC, and also the chair of medical oncology and medical director of the Clinical Cancer Research Unit. And Dr. Stephen Welsh is also the director of the Baker Center for Pancreatic Cancer. Dr. Dan Bredner is also a medical oncologist at London Regional Cancer Center at LHSC, as well as an assistant professor and the chair of the Molecular Tumor Board. Guys, welcome, welcome.
Thank you very much, Nick, and good morning. First off, my heartfelt condolences to the Verspeeten family. Gotta be honest with you, folks, I don't feel much like doing this today. I got to know the Verspeeten family very well, treating Irene Verspeeten and Ron Verspeeten as a medical oncologist. So I know firsthand how devastating this cancer diagnosis is to families, and I can only imagine how the family is grieving, family and friends. So it speaks so much to this family as to how they have turned this loss into something positive through the gratitude that they've shown through the donation that we are celebrating today. And it means so much that they have urged us to proceed with this today. So with heavy heart, I will proceed on and let everyone know the successes we've had and what we imagine moving forward with precision oncology here. And I'm going to share my screen here. Just a moment. So the POWER study, just give me a second here. POWER stands for Precision Oncology at Western. This is a program made possible through the Verspeeten Clinical Genome Center. And this is a study that allows us access to critical molecular information on tumors that in many circumstances can help guide smarter therapy to treat very hard to treat cancers. And I'm going to start with an example of the powerful nature that genomics can have. This is a story of a 17-year-old who lives in Northern Ontario. She's a First Nations woman. She's now 18 years old. She sought medical attention because she was feeling nauseous, her belly was getting bloated, and she was getting very tired. Things really unusual for a 17-year-old. I'm going to show you some pictures here, and if you're a little bit squeamish, you might want to turn away for the next 30 seconds. But I just wanted to clarify the point here about how devastating this was to this young woman. This is a CT scan. So essentially, this is a profile image. The liver over here, these are the pelvic bones. All of this gray stuff here is fluid that shouldn't be there. So her belly was filling up with fluid, making her very unwell. and we really suspected that it was cancer that was doing this. But it was a very difficult diagnosis to make. It took a number of weeks for pathologists to get together to figure out what type of cancer it was. And she actually had to have an operation. And this is a picture of what her ovary looks like with a lot of tumors on it. The ovary shouldn't look like that in anybody, let alone a 17-year-old. So now you can turn back if you were squeamish. The diagnosis turned out to be this rare condition called malignant peritoneal mesothelioma. Standard of care chemotherapy was given. She was in hospital much of this time. She really did not tolerate the chemotherapy well, and it wasn't doing very much. But thankfully, she enrolled in a research study that provided her information about the tumor, and she had a very rare what we call a fusion. So there were two genes that were fused together, STRN and ALK. And there were certainly case reports in the literature that suggested that targeting this particular fusion with a targeted therapy, in this case, ceritinib, but there are a number of other drugs on the market targeting the ALK protein, were associated with dramatic responses. So we went ahead and did that. And she was treated with this drug crizotinib, a pill, instead of the intravenous chemotherapy that she was struggling with and wasn't working. And lo and behold, after a few months, her scans look pretty near normal, not completely normal, but a whole lot better. This woman is now 18. It was touch and go there as to whether she was going to get that far. There she is, playing volleyball with her friends and enjoying life. So this is an example of where we can take things with genomics. The POWER study, we have taken this to our patients, and our medical oncologists have recruited across multiple solid tumors, almost 200 patients. With those 200 patients, we have reported back results on 75% of them, and have questionnaires of the medical oncologists of how they have used this information to identify how useful these treatments were. In addition to these patients, we've also have a separate study, and I don't have a slide for it here, but pancreatic cancer has been a focus, and we've recruited about 100 patients in this last year, specifically for pancreatic cancer. But this is all solid tumor cancers, and this is just a slide showing you all the different disease sites. So it's really across the board, many medical oncologists contributing to this. And so the end results, we did find positive DNA variants in most patients, and about half of those that had positive results were of interest to the physicians. So this is demonstrating this is useful information that to guide therapy. And how did this guide therapy? Either through standard of care treatments. Sometimes there are treatments that are available, but not for a specific cancer. That's what off-label treatment means. Sometimes we get access through a clinical trial or compassionate access. So we are using these informations in real life for patients, and not for everyone. So it's about a quarter of patients that we find it's meaningful. And now we think we can do better than that. And I think that Dr. Bredner is going to expand on that. But here are some testimonials from our medical oncology team about the role of this. So enabling treatment with targeted cancer drugs for patients with rare cancers. This is providing hope and potentially access to treatment. This is critically important information, and it is supporting a research initiative that is furthering the scientific excellence that we see in London, Ontario. So with that, I'm going to ask Dan Bredner to expand on where we feel we're going to go with this. So Dan, go ahead.
All right, thank you. So I appreciate that, Dr. Welch. And I'd like to start off by thanking the Verspeeten family for their very generous donation, because this really is making a huge impact to patient care. So I'd like to start off by talking about how I feel that the POWER study is helping patients and what it's doing. And so with this new generous gift announcement, we're going to be offering new molecular testing to the patients going on to the POWER study that Dr. Welch just talked about. And by testing for these new molecular alterations, largely fusions, when we find one of these really are game changers for these patients. And the way I view it, if you look at the screen, there's the testing that the province is paying for, which is really only on select tumor types. And then there's the great testing that the Verspeeten Clinical Genome Center has been doing for the last couple of years, where we're offering wider testing to really patients with all different types of solid tumors that have advanced disease. And now with this new donation, we're going to take that even further, right to the state-of-the-art testing for all patients with advanced cancers to really have us at the cutting edge of the testing we're providing those patients. And the way I see this helping patients is when patients have their tumors tested, first the Verspeeten Center does the testing. And when they report those results to us, when a patient has a finding, we, the oncologists, then take that information and use that in one of many different ways. One way might be that we find them a drug that is very personalized or the best available drug for them based on that mutation or fusion that they had. Sometimes this information allows us to personalize their care just to know whether one chemotherapy or immunotherapy or a certain type of treatment is more likely to work for them. And then the other way that it can really help patients is by connecting them with the most advanced and newest, most promising clinical trials. So I'd like to give a quick example of how the Verspeeten Clinical Genome Center changes our patients' lives. So I have a 66-year-old patient who unfortunately has metastatic lung cancer. And her cancer, unfortunately, recently started to grow after she was previously treated with chemotherapy. And so we made plans to put her on the next standard type of intravenous therapy. But I also requested that her tumor sample be tested at the Verspeeten Clinical Genome Center. And just a few days before she was set to start that new treatment in late March, one of our molecular pathologists contacted me and said, just so you know, Dr. Bredner, she has a ROS1 fusion. And so what this meant for that particular patient is a number of different things. First of all, it meant that treatment we had picked, I now know wasn't going to work based on this ROS1 fusion that she had. Secondly, she is now receiving a safer and more efficacious therapy. And she's now on a pill that will, on average, add years to her life of very good quality. One other thing I would like to mention about it is for this particular patient, she lives out of town and depends on her sister to drive her into appointments. And that's always been a great deal of stress for her. And now that she's on this pill, she isn't going to need to travel into London to see me in person in the cancer center as often. So in her case, this testing has literally added years to her life, probably better quality years, and just overall lessen the burden on her family. Another way that I see the Verspeeten Clinical Genome Center improving patient care is if you look on the left side of the screen, that's an example of a clinical trial we decided to bring to London some time ago. And those X's are going through different groups within the clinical trial that we just weren't going to be able to enroll patients on because we weren't doing that testing. Now with this new gift announcement, with the expanded testing, we're going to be able to accrue to all of the different cohorts within this study. And really what that means is it means we're going to be able to connect more patients with this new hopeful type of treatment. And they can do that right here in London. One other thing that the Verspeeten Clinical Genome Center has really made a difference in the oncology care we're providing here is we train a lot of different medical students, residents, and oncology fellows here. And all of those people will get some level of oncology genomic training. And I can tell you their feedback. When we used to teach this and we're showing case reports and things from outside of London, it's just not as interesting. Now we're doing this with patient examples from right here in London, reports from the Verspeeten Clinical Genome Center. And I can tell you the feedback on how engaged they are is totally different. And they're now going to take this enthusiasm and knowledge out to the other medical centers where they work and practice and teach in the future. So we really are reaching out to other centers with this training. So at this point, I'd like to thank the Verspeetens once again for the very generous donation and for their support of the Verspeeten Clinical Genome Center. Thank you.
All right, thanks, Dr. Dan and Dr. Stephen. Very, very informative and very insightful. Thanks a lot, guys. Okay, right now I want to welcome Jennifer Masters to join me. Now, Jennifer is the Director of Molecular Diagnostics, Partnerships and Innovation for the Verspeeten Clinical Genome Center at LHSC. Welcome, Jennifer.
Good morning. Thank you, Nick. And good morning, everyone. I am really honored to be here, especially amongst this group of individuals, to be talking to you about the work that we do at the Verspeeten Center. And as a scientist first and a business administrator second, I really love to unfold and resolve puzzles. And what a bigger puzzle than cancer itself. And so what I'd like to talk to you about today, and I'll share my screen, is how the work that we do at the Verspeeten Center actually allows us to influence how the health system changes how we provide care and diagnostics to our patients. And we did hear a great deal of information from Dr. Bredner and Dr. Welch regarding some of the work that we're doing currently. But what I would like to do is to start on a story of our historical path that really highlights how we as a lab was able to influence the change for hereditary cancer. So back in 2014, a mere 8 years ago, our laboratory was testing 2 genes for breast cancer. Those 2 genes, BRCA1 and BRCA2, they were known to be very specific to causing aggressive breast cancer. But the testing to do that was actually quite laborious and very costly. And over time, that would limit the ability for us to test a broad group of patients who we know have a high risk of developing cancer through family inheritance. So when Dr. Sadikovic joined our laboratory, he took it upon himself and the laboratory as a mission to be able to increase our ability to do testing for patients, both in terms of number and the genes detected. What's interesting, if we go back to the 2014 days of testing 2 genes, when we were testing those 2 genes, we were doing 2 assays consecutively for 2 different genes, which would result in a turnaround time of about 6 months. And that was not good enough for a lot of these families to make decisions about care. And additionally, because we knew there were additional genes that were important in causing breast cancer, some of those patients, if we received a negative result, would be sent for more testing in the US. So I can only imagine how expensive that would be over time. So with Dr. Sadikovic's guidance and his innovation and understanding of research in a clinical environment, the team developed a gene panel which tested for 25 genes known to be linked to breast cancer. And not only that, those genes were actually tested consecutively for those 2 different assays that we were once doing in tandem. That reduced the time to result from months down to weeks. And so the benefit of that is now more families are being able to be tested, and we're able to do that at a much lower cost. So skip forward to the future, and we've added gene targets with the collaboration of our medical oncologists and medical geneticists across Ontario to include genes at 30 and 37 tests each year, to be able to expand and acknowledge that there are other tests that are causing cancer through family. The great news is that through a lot of advocating and a lot of engagement with our provincial partners at the OH and CCO, our team, as a collaborative effort, was able to influence the inclusion of many more patients and many more genes. So today, as of April 1st of 2021, the hereditary cancer testing is now offered to, is now including 104 different genes. And those different genes are offered, or the different gene panels are offered to a wide variety of patients who have a medically known risk of developing cancer. Now, the story of the hereditary cancer testing is really one story that highlights the need to have a very collaborative and evidence-based group to be able to drive change within our health system. And the hereditary cancer testing is one of those. And it did take some time to be able to get to the point where we are now testing all patients within Canada who have a risk for hereditary cancer. Another situation that we've been able to be a part of, and only to show that this is the new model of how diagnostics and clinical work join together to be able to drive change and to influence how patients are cared for. But our laboratory was selected to be the first genetic testing program for Ontario for individuals with epilepsy. This program is a cross-functional, evidence-based collaborative program. It engages epileptologists, neurologists, diagnosticians, geneticists, and Ontario Health. And it is a model that we foresee as being the future of how we move forward with somatic cancer testing. In fact, when we look at the program that we have developed with the POWER study and within the Verspeeten Clinical Genome Center, this program is really that type of a model. We are looking to gain the knowledge and insight and support from all of our experts within cancer genetics, oncology treatment at the clinician, and pathology to be able to drive change. And it is through some of this evidence generation that we are moving forward to provide evidence to Ontario Health to make change within the funding of this testing. I am pleased to announce that as of this last fiscal year, April 1st, we have increased the number of tumors that and CCO are funding to support somatic cancer gene sequencing, so to 16 new tumors. And that list continues to grow, which is fabulous news. It's fabulous news for us because now at the Verspeeten Center, some of the tests that we knew were of value and the Ontario Health has agreed provides value to patient care, we can now shift some of our efforts to other tumor types to look deeper into the testing that we do for other cancers and develop a database that is only going to further our understanding of cancer. And cancer is very complex, we know that, and every tumor cell has a different story to tell, and every person's tumor has a different story to tell. And so the benefit of us being able to do much more testing now, and including with this new funding announcement, we will be able to grow our database and our evidence within the Verspeeten Clinical Genome Center, include patient outcomes, and include the health economics benefits for doing this type of testing for patients with cancer, to be able to then change the face of how we treat cancer in the future. So today is a great day, and I do send my sincerest condolences to the Verspeeten family. Your legacy will certainly live on with this program, and we are driven by your passion to solve cancer, to continue to make a change. I want to assure you that our great work has only begun. We continue to try to find ways to provide evidence and to build our story for the province so that every patient who has cancer has the opportunity to get the diagnostic testing that can lead to outcomes such as the patients that Dr. Welch and Dr. Bredner had described. So thank you again to the Verspeeten family. I know we have much more to do, but I think that as you will hear with Dr. Sadikovic, We are not only focused just on the genes and the genome, but we are now moving beyond the genome. Thank you.
Okay, thank you very much, Jennifer, and thanks for being a part of this morning's program. All right, up next, I'd like to invite Dr. Beckham Sadikovic to join me. Now, Dr. Beckham is the Clinical and Scientific Director of the Verspeeten Clinical Genome Center at LHSC. He has also recently been awarded the Limited Term Chair in Genomics and Epigenetics. Dr. Beckham is the Program Head of Molecular Diagnostics, Pathology and Laboratory Medicine for London Health Sciences Centre and St. Joseph's Healthcare London, as well as a professor of Pathology and Laboratory Medicine at the Schulich School of Medicine and Dentistry at Western University. Welcome, Dr. Beckham.
Thank you, Nick. And I'd like to start by offering my sincerest condolences to Verspeeten family for their loss. I'd also like to start by really thanking them for their generosity and support to our program and their vision, which I define as a vision to provide access to better care to patients affected with cancer in our community through the advancements in personalized medicine. I'd also like to thank London Health Sciences Foundation. There's a lot of work and dedication that goes into connecting our community to the various patient care improvements that are happening at London Health Sciences, amongst which one is Verspeeten Clinical Genome Center. I'd also like, before I tell you a little bit more about the work we do, to thank LHSC leadership and specifically Dr. Jackie Schleifer-Taylor for providing the world-class environment for developing innovation in patient care at LHSC. Recently, the Academic Realignment Initiative, which was initiated by Jackie through LHSC Research Institute, London Health Sciences Foundation, and Children's Health Foundation, has, as it's been mentioned, provided a strong commitment to LHSC and Verspeeten Clinical Genome Center, and a personal honor for myself to being awarded the inaugural LHSC Research Chair in Clinical Genomics and Epigenetics. So I want to start by reflecting a little bit on the work we've done in the last 2 years without really going into too much detail, because Dr. Welsh and Redner and Jen had really done a great job highlighting a lot of these features. But I should say that we've demonstrated how advanced genomics is providing direct and measurable impact on patient care. I should say that POWER study, certainly our pillar study, is going to continue to evolve and push the cutting edge in personalized medicine. Jen Masters had told us how these advances in genomic medicine ultimately can impact the policy. And I think our goal is going to continue to be to try to identify areas where we can use genomics to improve what we consider to be cutting edge of the patient care, but also with the eye on the opportunities to influence policy, because policy ultimately ensures sustainability and broader access to this patient care, beyond our region. The other couple of things I want to mention that may not have been talked as much in the previous is really that we've had a lot of growth in our academic mission, and we're enabled to provide advanced training to our clinicians and scientists. We're able to attract some top talent. VCGC has become really a research and clinical bioinformatics hub. We're currently training, master's, PhD, postdoctoral students in affiliation to Western University, as well as research associates, bioinformaticists, genome analysts through the Lawson Health Research Institute. We've had a very significant academic impact over the last couple of years. More than 40 manuscripts had come directly out of ECGC in the last couple of years. We've been able to attract millions in additional research funding through national and international funding agencies, which really demonstrates the ability really to leverage the philanthropy and the donations from the Verspeeten family in a great way. And a lot of our work is now, really taking the center stage internationally. A lot of us are presenting regularly now keynotes and platform talks at numerous leading national, international conferences in the space. So this is what's been happening over the last couple of years. But what we'd like to really kind of talk a little bit about is where we see the future of ECGC. We certainly think that this is, a facility that's going to continue to grow and develop. And one of our, standing goal is to, continue to pursue advancements in genomic-driven care for patients. So basically expanding on the work that we've currently described and going much beyond that. As the policy shifts and the standard becomes advanced, more and more advanced, we'll continue to push to try to create evidence to continue to push that standard. But I want to tell you a little bit about is the work that we're kind of moving into now through the Verspeeten Genome Center, particularly to focus on cancer, and that's the work of epigenomics. I should just quickly define what epigenetics is. So epigenetic mechanisms are essentially chemical signals that are layered across our DNA. They act as on-off switches for thousands of genes, and they can fine-tune our biology. They can adapt to changes in our environment as well as our behaviors. The problem with epigenetics, much like genetics, is that these mechanisms are not perfect. Individuals can experience both genetic and epigenetic defects that can lead to disease. While we know quite a bit about, and we're continuing to learn about genetic effects on disease, epigenetics knowledge is probably a little bit more in an infancy, in a kind of a more direct-to-patient care setting right now. What we'd like to do is to layer the epigenetic information on genetic information to better understand, diagnose, and effectively treat disease. And we really need to develop technologies that are going to allow us to really scale this up and put it into a routine patient care. So these epigenetic signatures, or we call them episignatures, are essentially novel molecular biomarkers. We've done quite a bit of work in this space in the lab over the years in the space of rare disorders, genetic disorders related to neurodevelopment and developmental biology. These are standard hereditary genetic conditions. And we are now the first lab in the world to develop a technology using clinical setting to diagnose patients using epigenetic profiling. It's called, technology is called EpiSign. And as I mentioned, we're using it and we're partnering with labs around the world that are actually using our technology and our bioinformatics and algorithms to diagnose patients with genetic diseases. What we really want to do now is put some of the effort to focus on cancer and the work to the Verspeeten. So there are a number of major projects where we're really looking to kind of apply these, layering of epigenetic information to develop better diagnostics. One area of interest certainly is pancreatic cancer. We're doing quite a bit of work in collaboration with the Baker Center. There is an ongoing work to develop genetic and epigenetic biomarkers related to aggressiveness of pancreatic cancer. There's an ongoing initiative with Dr. Chris Pinn and his lab to develop a local organoid facility where we'll be able to grow these tumors and test these tumors in order to be able to directly apply this information to direct patient care. We think there's a lot of opportunity in brain tumor classification. There is a lot of emerging evidence that epigenetic or DNA methylation markers can provide better and more accurate diagnostic stratification for patients with both pediatric and adult brain tumors. We are working with the Western University Brain Bank, and we hope that this work will ultimately lead to development of epigenetic biomarkers that can directly impact management. One other area of work that we're doing quite a bit, and really we're leading the efforts both provincially and nationally, is in the space of molecular diagnostics of hematologic malignancies. We've been doing broader genomic profiling for patients with leukemias, including advanced NGS testing for years now, and we've tested thousands of patients and provided ultimately what is a changing standard of care for this in the province as well. The problem, though, is that we're running into a very interesting situation. The more genetic information we get, the more uncertainty we can uncover in certain aspects, because some of the genetic information we cannot explain through standard genetic analysis. By doing epigenetic profiling, it might allow us to reinterpret genetic findings to find more conclusive answers for patients with leukemias, and to ultimately have an impact on their patient care in a significant way. And of course, there are other studies, such as just mentioned briefly, prostate and endometrial cancer, where we are also working on defining epigenetic markers that would allow us to separate more indolent from more aggressive cancer subtypes. And again, the idea is to have direct impact on patient management as a result. I will, finish my short presentation here by what I think is the vision for the Verspeeten Clinical Genome Center. We want to grow Verspeeten Clinical Genome Center to become an international leader in advancing genomic personalized medicine. We want to translate genomic research advancements to direct impact on patients affected by cancer and other genetic disorders in our community. We want to influence health policy by ensuring sustainability and adoption of our innovation nationally and internationally. And finally, we want to grow our local talent and attract top scientists and clinicians in genomic medicine to London Health Sciences. With this, I'd like to reiterate my personal thanks to Archie and Verspeeten family. Your vision and generosity are making a real impact on our patients, their families, and our community. And if I may dare to say so, your support is setting the foundations for the long-term and very broad impact on society at large. With that, I thank you and bring it back to Nick.
All right. Thank you very, very much, Dr. Beckham, for that very informative discussion there. Now, guys, I want to invite all of our presenters back. We have a few questions for you. There you are, guys. First of all, thank you very much, guys, for sharing the impact that the Archie and Irene Verspeeten Clinical Genome Center is having on patient care at LHSC, and for sharing the impact of this $3 million gift and what it will have moving forward. Now, we look forward to hearing more great news coming from the Verspeeten Clinical Genome Center. So guys, I've got a few questions here and I'm gonna direct them here. The first one is for Dr. Beckham. So can you share what the international reaction has been for what's been accomplished so far at the Verspeeten Clinical Genome Center, and what impact does that have? Dr. Beckham.
Thanks, Nick. So I think in this presentation, we really highlighted the impact we've had on the local and provincial bodies in ensuring that we're providing better care for our patients as well as patients across the province. We are looking to certainly go beyond this work and impact this work within the province of Ontario. And there are quite a few national as well as international efforts that are happening. So we have a lot of different studies involving the Verspeeten Clinical Genome Center, where we have national and international collaboration in this space. Currently, our center is collaborating with over 20 countries, with over 100 institutions worldwide to develop diagnostic biomarkers in the space of genomic disorders. We are engaged in national and international trials. I mentioned epigenomic diagnostic technologies. EpiSign-Can is a national trial involving about 18 centers across Canada, where we're currently testing 4,000 patients to develop health system impact evidence for introducing epigenomic technology into routine care in Canada. And there are similar efforts that are happening like this in Australia, in Europe, and other kind of large-scale collaborative efforts. We've been able to attract significant external funding, from both national and international sources. As I mentioned, quite a few publications, invited talks that are really bringing out the prominence of ECGC and LHSC internationally. And as of recently, we are getting engaged in the international bodies that are looking at developing guidelines for use of genomic and specifically epigenomic diagnostic technologies in patient care.
All right, thank you very much, but don't go away, Dr. Beckham. I got one more for you here. Now, how about, it was recently announced that there will be a limited term chair in clinical genomics and epigenomics. What does it mean for the Verspeeten Clinical Genome Center to have a term chair in clinical genomics and epigenomics?
Well, thanks, Nick. So, Verspeeten Clinical Genome Center was a brainchild of a few people, a few years ago, and a very generous donor who happened to believe that vision. What recognitions like a research chair do, in particular, a research chair from London Health Sciences, they establish LHSC's full commitment to align with the Verspeeten vision. of integrating genomic and epigenomic medicine and innovation patient care. It is no longer a vision of a few individuals and reflecting the patient need. It is actually something that's supported by our institution as one of the key pillars that they want to invest time, effort, and energy resource. Personally provides me with the bandwidth to lead this effort, to be able to continue to nurture the scientists, clinicians, and students that are involved in this process. It increases our ability to attract external funding, and I think in the long run, it enables development and translation of innovation that will ensure long-term sustainability for the program.
All right, thank you very much, Dr. Beckham. Now, next up, we have Dr. Dan and Jennifer. I have a question for you guys. As of today, $6.3 million of the $10 million goal has been raised for the Verspeeten Clinical Genome Center over the past year and a half. What is the plan for the remaining $3.7 million that is needed to complete the full vision, and what will be done with the money raised, guys?
Sure. I can go first for that. I guess so. I mentioned that this generous donation brings us to the cutting edge of the genomic testing we're doing now, but that bar is going to continue to move as time goes on. And so I think ongoing efforts are needed to continue to raise money, because we're going to have to stay at the cutting edge. And where I suspect that's going to be is looking at patients' tumors that amplify or overexpress certain things, so we can personalize their medicine to direct it towards those targets, or to make them eligible for future clinical trials that are going to target those. And that's really going to give them unprecedented access to those advanced clinical trials right here in London.
Yeah, and so from my perspective, one of the challenges that we have within diagnostics and medicine is the cost of a lot of these tests. And so the additional funding allows us to actually cover the costs of testing to be able to offer testing to many more people. But not only that, we need scientists. So we need scientists to be able to support the development and the innovation. We need scientists and bioinformaticists that will do the analysis and deep dive into what these new genetic mutations mean overall and in very different tissues. And then finally, it's an investment in terms of a whole bioinformatics program. So we need to be able to develop machine learning algorithms, because as we get more and more complex data, the more and more we require computers to be able to do some of the thinking for us. So this is certainly where a lot of the funds are going to be utilized.
All right, thank you very much, Dr. Dan and Jennifer. Okay, up next, we have Dr. Stephen Welsh here. So Stephen, for you, currently the Verspeeten Clinical Genome Center is very focused on cancer research, primarily pancreatic cancer. What is the broader scope of capabilities through the center? That's one. What kind of infrastructure and resources are needed to fulfill those opportunities? Dr. Stephen?
Okay, thanks. And I think Dan and Jennifer may have answered a little bit of this. I'll kind of put a little bit of a different spin on it. In terms of the capabilities through the center, I think I'll sort of repeat what Dan has said. I think we want to remain on the cutting edge of what is known about molecular genomics and how we can avail our patients. Our focus, I mentioned pancreatic cancer, and certainly our focus clinically has been on the hard to treat cancers, and there's not very many harder to treat cancers than pancreatic cancer. So I think that explains why that has been a primary focus. But I think that with increased funds, we can take this to a broader patient population with a focus on the harder to treat patients. With regards to infrastructure and resources, I think that it's kind of easy to understand, these tests cost money, you need money for machines, and each test costs, but I think that the critical investments that need to be made are people. So, the term chair, I think that, just to explain that a little bit, term chair, I'm sitting on a chair. What are we talking about here? So the term chair, this provides, as Beckham has said, the bandwidth. So it's supporting him to do the thinking, to innovate. And I think that's a critical piece help with further innovation. It's buying his time and bandwidth to allow him more time to do this innovation. But in addition, there are a lot of other individuals, research coordinators. We have a fantastic research coordinator group, Leanne Pickard, Haley McConkey, who without them, much of what we've presented today about power just really wouldn't happen. So I think that critical investments in coordinators, trainees, to invest that money in things that will bear fruit with further. If we are strategic in that, we are more successful with further grant funding to take that $1 million and turn that into $3-4 million. So hope that answers the question.
All right, thank you very much, Dr. Stephen. Now, next up, we have Dr. Dan. We want to get you back in here. What does the increased capabilities mean for patients in London and the surrounding area? Dan.
Thank you. I think one thing that it does is it's going to, as our international and national profile grows, as we have a bigger research and translational research footprint, it gives our cancer patients more faith that they're getting the best treatment and that their tumors have been tested for everything. I think it's really taken us beyond the point where some patients wondered, should they get their treatment closer to home here in London, or should they consider driving a couple hours down the road to Toronto to access other trials or other types of testing? That's really behind us. This has brought us to the point that we're going to have that all right here in London, so patients aren't forced to make a decision like that anymore.
All right, thank you, Dr. Dan. Beckham, you're up. Dr. Beckham, you're up next here. Can you explain how epigenomics will redefine patient care? Dr. Beckham.
Well, that's a loaded question, but I'm gonna attempt to do it. I've had passion about epigenomics for the past 20 years. Since I was a graduate student at the London Regional Cancer Program, studying the epigenetic profiles in breast cancer. For the longest time, we knew that these epigenetic profiles and signatures change in cancer, and they may tell us something about cancer. One of the things that's happened just over the last few years is that we've developed technologies where we can harness this information for very practical, patient-centered impact. And I think, as I mentioned earlier, we are able now to use these epigenetic patterning and profiles to very specifically define and diagnose patients with specific genetic conditions. So we're going to continue to do that. But one thing that differentiates epigenetics from genetics per se is that it's environmentally responsive and it's plastic, as we call it, reversible. A lot of the genetic changes are hard fused into our genome and oftentimes present some difficulties with the ability to kind of treat and manage. As we say, sometimes we can target the mutation, but we can't change the mutation, right? On the other hand, epigenetics, because it's reversible, presents really an interesting opportunity, not only for diagnosis, but for an opportunity to do things like targeted therapy development. We know we can change epigenetic patterns. So if we can identify the right ones and we know how we want to change it, we may be able to reverse how the cancer grows and so on. So that's actually really a very, very exciting opportunity. And of course, they can be used also as surrogates for measuring the impact of standard therapies. If a certain cancer has a certain methylation profile, in order for us to know if the patient is responding to a therapy, we may be able to use these epigenetic profiles as an accurate measure of how effective a particular therapy is. So there's a lot of opportunities.
All right. Thank you very much, Dr. Beckham. All right. Our final question goes out to Jennifer. We have heard the great things being done at the Verspeeten Clinical Genome Center and the future plans. Why is donor funding integral to the center and those future plans? Jennifer?
Thanks, Nick. And I'll put my administrator hat on here because within the clinical environment, we have limited funds to be able to do the testing that we do for our patients for what we already know is standard of care. And so the only way that we can do and invest in innovation is through our donor programs. And without the funds, we are really not able to do the deep genetic sequencing that is required to be able to move the pendulum forward. So it is critical. The donors are critical to us being able to move this forward.
All right. Thank you very much, guys. Thank you, Jennifer, for being a part of the panel, Dr. Beckham, Dr. Dan, and Dr. Stephen. Thanks a lot, guys. And at this point, we're just about wrapping things up. I just want to tell Archie and the Verspeeten family, Archie, thank you so much for this very kind and generous gift. But also our hearts, our thoughts and prayers go out to you today on such a difficult day. So thank you very much, Archie, for all that you and your family have done. And again, our thoughts and prayers go out to you today. Right now, we'd like to introduce and share a short video with you about the Verspeeten Clinical Genome Center.
Clinical trials are the way that we get ahead in treating cancer in general.
Without doing that, without starting a clinical trial, it's impossible to be able to bring those therapies to the clinic, and it's impossible to bring those therapies to other places in the world.
There's no question that donor support are the only way this is going to get off the ground and the only way we're going to get towards that vision. In a field like cancer, where we don't have perfect treatments by any means for anybody, and we have to continue to get better and better and better, we need this investment to stay on the forefront and be able to offer the best options for our patients.
And I think for patients to have those increased options, that increased support, really means everything to the program.
The key objective for the center is to provide personalized and tailored genomics-based care to a larger fraction of patient population, and then influence others, whether or not it's our ministries or in a commercial setting, to take Canadian innovation and to be able to, more broadly showcase it and provide it to the rest of the world.
And so for us, taking as an example a single donor dollar, we can very quickly leverage that through public grants, through commercial grants, so the $1 becomes $2, probably $4. We can then work with different government groups and large-scale grants to suddenly bring that $4 up to $8. And so that first donor dollar can be the start of changing the entire system.
Thank you, Nick, for moderating our announcement today. We truly appreciate the work you do for us on an ongoing basis. So thank you for that. And also thank you to our panelists for sharing the impact of the Verspeeten Clinical Genome Center, both currently and in the future. As you can see, we have a very bright future with this center, impacting patient care not only locally but internationally. So thank you all for the work that you do and for presenting today for us. And of course, we're truly grateful for the transformational gift of Archie and Irene and the family, not just this $3 million gift, but also 18 months ago when they created this center with a $3 million gift. As has already been stated, centers like this just simply do not get created and can't have the success without the donor support and, frankly, the leadership and vision of you, Archie, and your late wife, and of course your family, and also just has already been stated as well. But I just also want to say how difficult a day this is for everybody involved, and obviously for you, Archie, and the family, and our hearts and prayers do truly go out to you. But thank you so much for encouraging us to move forward. And I know Ron would have been thrilled that we did so. And I know he's up there looking down saying, this is amazing, this is great, and being excited for the future of the Genome Center. So thank you for that. And I also want to tell folks that if you want to learn more about the center and the great work it's doing, or if you want to support it, please feel free to go to lhsf.ca /Archie and Irene to learn more and to provide support. So thank you again, everyone, for participating. Thank you to Archie and the family. And we look forward to the great work of the Verspeeten Clinical Genome Center and more exciting announcements on that great work as we move forward. Thank you all and have a wonderful day.